Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. We're going to be talking about trigger point therapy for the occiput. This is the ridge of the back of your skull. There's a muscle there. When it gets trigger points, which are knots in the muscle, gets trigger points there, it can send pain to the top of your head, like a headache, to the back of your head, right where the muscle is, also behind your eyes. Also, it could affect your jaw. So these trigger points here can really affect a lot. So I'm going to be using techniques described in the Trigger Point Therapy Workbook. Great book full of great information. And also we're going to be using the Miracle Ball method. Again, great. You need to get one. And I have my tools. I have tennis ball and a sock. Actually, I have two. The reason for the sock is so they don't roll away. And the first thing we're going to do is we're going to lay on the floor. Now, if you're having troubles which prevent you from getting up off the floor, let's be smart, don't get on the floor. But it's best to do it on the floor because you need something firm. So, you're going to take your tennis balls and the sock, or golf balls will work too, and you're going to rest on them. They need to be separated a little bit. Find that sweet spot, and then rest your head right there on the tennis balls. And you want to breathe, and you may feel some tenderness there, like a good pain. It should be a good tenderness, not a bad pain. It is unusual to get or not to feel bad pains if you have trigger points here, because there's not a lot of nerves that run on the surface of the skin. But you want to hold this here for 10 seconds, move the balls around a little bit, find other trigger points. Make sure you're breathing. That's another rule. And so that's the tennis balls on the occiput. The other thing you can do is take one of your miracle balls and put it behind your head. Now the miracle ball works a little bit differently because it is about relaxing the muscles. So you want to breathe deeply and lay here for 2 to 3 minutes. So it's going to seem like a long time, but you breathe deeply, allow your muscles to relax. And then after 2 to 3 minutes, here's phase 2. You have to relax your head off of the ball. This is the second half of it. This is also working on relaxation. The other thing I want to show you that's great for working on the occiput, this is also great for the cranium. This is called a still point inducer. And you can imagine what we call this at my house. Hey honey, have you seen my, I'll let you fill in the blank. So you want to put that behind your head. And this is called a still point inducer because it's actually working on the cranial rhythm. The cranial bones have a rhythm that pumps the cerebral spinal fluid around your brain and spinal cord, and this helps to restore that. It's not the do-all, end-all, be-all, but it can help, especially if you're one that does get cranial work. And this you do want to relax on. Again, try to let the muscles relax. You want to breathe deeply. This you can lay on for 10 to 15 minutes. So there you go, putting the power and knowledge of your health back in your hands. Bye for now.